Action News, Delaware Valley's leading news program, with Gary Papa, meteorologist Cecily Tynan, and Jim Gardner.
On Health Check at 11, headaches. Almost everyone gets them, but some people have a very hard time getting rid of them. A Cherry Hill, New Jersey doctor is using an unusual method to help patients for whom the throbbing and pounding never seems to go away. For 20 years, Jamie Gordon's favorite view of the world has been the view from the lens of her camera.
It's about the feeling, and I want to capture that. I want to take it home in my little box.
But that feeling nearly disappeared 3 years ago when occasional, ordinary headaches snowballed into daily migraines.
It's like a knife in my eye.
Despite a string of medications and treatments, the pain persisted. Jamie's photography ended, and so did her driving.
I just felt like I was dying. And truthfully, part of me was.
But on a visit to Dr. Scott Greenberg, she discovered a solution: prolotherapy. Dr. Greenberg injects a combination of anesthetic called lidocaine and dextrose, a sugar, into areas in Jamie's neck and shoulder where he believes ligaments or tendons are damaged.
We see damage in the cervical facet joints and also in the back of the head where all of the muscles from the neck go up and insert in the back of the skull.
Ligaments, tendons, and cartilage have poor blood supplies, so when they are injured, they can be slow to heal.
In addition to that, sometimes we take anti-inflammatories like Motrin or Advil that block the healing process.
The injections, given every 3 to 4 weeks, are intended to reduce inflammation and jumpstart the healing.
What the dextrose does is it basically causes the release of growth factors out of the tissue.
Prolotherapy has been around since the 1930s, but was used largely for sports injuries, not headaches. Today, advocates for its use to treat headaches and other ailments include former Surgeon General C. Everett Koop. And a clinical trial on prolotherapy is now underway with the National Institutes of Health. For months, 16-year-old Laura Allen suffered head-crushing pain, apparently triggered by a bad reaction to a vaccination.
It was to the point where I couldn't get out of bed. I was phonophobic and photophobic, which is light and sound sensitive.
It took a long time, and Laura admits the shots were painful, but she says they were well worth it.
I do not have any head pain anymore from it.
Dr. Greenberg became a believer in prolotherapy after giving himself the shots in a last-ditch effort to relieve headaches he suffered long after a car accident. The pain nearly derailed his medical career, but today he leads a full and active life.
And I function every day. I bike ride, I play hockey, I work out, and I work all day long, and I do not get a headache at all.
Well, unlike steroid injections, which provide only temporary relief for some pain, prolotherapy injections given over a period of several months usually provide permanent relief. Dr. Greenberg says the length of treatment depends on the extent of the injury. However, treatment can be started even years after the initial injury. And once there is some relief, it should last as long as there's no new injury to that area. Most insurance companies cover some part of the cost of the treatment.